Many of my patients, because of this pain, started using eating as a coping mechanism. I have heard so many times about my patients going to their room and eating in secret, or going outside to a secret place and eating to self-soothe. And then that coping mechanism becomes very strong, and many of my patients use that coping mechanism for years and years and years, into their teenage years, into their young adult years. Then, the third theme, when they come to have weight loss surgery, just like my patient that I mentioned, I'll call her Ginny, I'll change all the names for confidentiality. They have weight loss surgery, and these emotions just flood them because they don't know how to cope without food. Okay, so those are the themes that I've seen as I've worked with these patients. So, what do I do with them? The first thing that I do is I try to help my patients anticipate the challenges of weight loss surgery. I help them understand that weight loss surgery, it's not just tough physically, but it can be very, very challenging emotionally. It can be a real roller coaster ride. I help them recognize and experience their emotions in a safe, healthy place, rather than just sort of numbing the emotions with food or escaping the emotions with food. And as I alluded to earlier, I help them discover and implement specific, healthy, non-food related strategies for coping with their emotions. Okay, so that's the approach that I take. Okay, and I just brought a quote in just to help sort of put words around what the experience of weight loss surgery can be like emotionally. This is my client, I'll call her Carrie. The psychologist who evaluated me before surgery said it could be difficult emotionally, but I had no idea how hard it would be. As the weight started coming off, I was excited and terrified all at once. Choosing new clothes, facing old fears of dating, there were so many feelings, and I no longer could binge to escape them. Sometimes I just wanted to go back to my old life, hiding from the world in my apartment and just eating. I've had many clients come in and say, I don't know if I should have done this, it's so hard. It's so hard. And my job is to help make it easier with these coping strategies.